Right, Mercy.
Started. So we allow people to join first. We give them an allowance of 2 minutes, or we just begin, Ivy.
Yeah, we can allow people to stream in.
Okay. So hi everyone. Hi everyone. Hope we all are well. Welcome to today's session that is going to be hosted by Y Plus Global. It's going to be amazing. It's going to be fun, especially because it's very useful. Welcome our panelists. Welcome our attendees, our participants. Feel free just to type your name on the chat box and the country you're listening from. We are so happy to have you here. I would like to invite my fellow moderator, Ishmael, just to introduce themselves as we progress. Thank you. Okay. It seems like we lost Ishmael a little bit, so we can progress. Thank you so much for joining us today. My name is Mercy Wanjiko from IRF Kenya, Ambassador for Youth and Adolescent Reproductive Health Program. I will be your moderator for today, hoping that you're going to have a very wonderful session. Yes, I would love to just give a brief background of this session that we're going to be having today on from commitments to action, mental health in HIV programming, and the intersection between HIV and mental health is critical, yet often it's overlooked. Within areas of global health, the relationship between the two is very directional. Poor mental health significantly increases the risk of HIV infection, while living with HIV dramatically heightens the likelihood of developing mental health disorders. Research indicates that up to 62% of people living with HIV suffer from common mental disorders like depression, disorders like stress, and mental health disorders. Moreover, individuals with pre-existing mental health conditions are 2.5 times more likely to contract HIV. These coexisting conditions coexisting conditions create substantial barriers to accessing HIV prevention, testing, and treatment services, further exacerbating the health outcomes for those affected. In the light of these challenges, a satellite session was organized during AIDS 2024, where experts discussed the integration of HIV and mental health services, highlighting the key points. These key points are very crucial for us. So the first one was impact. The integration of HIV and mental health services is essential for improving both HIV outcomes and overall well-being. The second point being prioritization. HIV programs are increasingly prioritizing mental health and securing resources despite a shifting global health landscape. We can all see how what the importance of integration of HIV and mental health. while we also face some challenges, like significant practical challenges remain for HIV programs, attempting to integrate mental health services. And then we have donor priorities. In some instances, there's a critical need for sustained donor commitment and funding to support these integrated services. So we emphasize like there should be a lot of donor priorities on matters of integration of HIV and mental health. And then there's practical solutions, identifying and implementing strategies to incentivize and support the integration of mental health within the global health architecture is crucial. So as a follow-up to this session, YouthWISE Global and its partners, the partners you can see on our panels, Ali, Yves, Burutulo, Chikondi, are partners of the YouthWISE project funded by AIDS Founder. We have a webinar here that is going to disseminate insights, focusing specifically on all the commitments of integrating mental health and HIV programming. And this webinar will center on young people living with HIV across diverse contexts, providing a platform for them to understand and engage in these developments. So there is high-level representatives from United for Global Mental Health. There is PEPFAR. PEPFAR is represented in the panelists. UGMH that I just said, United for Global Movement Health, is represented here. And also we have other country partners who will contribute to this discussion, who are our panelists today, and with a strong focus on youth and sustainability. So just before I give to Ivy, just to welcome us and give us a brief background or just a brief the YouthWISE impact study reports. I just want to read on the comment chats. Yeah, on the comment chats, welcome. I can see a lot of us have turned in our participants, and they are really typing inside on the chat. And yeah, welcome. I can see we have Josephine Odhiambo from Kenya. We have Maina PD from Kenya. We have people from Tanzania. We have some representatives from PEPFAR. Welcome, welcome, welcome. And it's an honor to have you here because this is a global platform that you're going to be doing. We are going to be discussing, having wonderful conversations here. So over to Ivy, and feel welcomed, everyone. Thank you.
Thank you very much.
So it's Ivy. Our names are almost similar, yeah. So Tawanda, maybe my slides.
Is it fine for me to share my slides now?
No, I will go fast and then
okay,
you will come in, yeah.
Thank you, Ivy.
Thank you, Yves. Just a minute for the slides to come up. So as Tawanda is showcasing the slides, a brief introduction of what the YouthWISE project is. So YouthWISE is a youth-led and women-led project that is supported by AIDS funds and implemented in Kenya and Malawi by country partners such as Y+ Malawi, the Coalition of Women Living with HIV in Malawi, and in Kenya by IREP and Y+ Kenya. So it is a project that was initiated, again, as I've mentioned, by AIDS funds in collaboration with the networks of young people living with HIV to essentially ensure that young people have access to self-care services. And my slides are up, so I will be presenting on an impact study that was conducted on the YouthWISE project to showcase the impact that we've been able to achieve across the years of implementation. So this is the last or the final year of implementation for the project, and we've been able to gather quite a bit of key results and changes from our implementation. Disclaimer, the research is still not finalized, the report is not finalized, so these are things that we were able to pick on from the draft that we have, and we thought it was important to share since this is the final webinar we'll be hosting under the YouthWISE project. Next slide. To start us off, our research team thought it was important to collect key stories from young people that benefited from this project, and this is one of their stories. So one of the participants said that many of these young people or young individuals felt trapped in a cycle of silence. They were reluctant to share their experience of concerns, fearing judgment or rejection. As a result, they often lacked critical information regarding their health and available resources. This ignorance amplified their anxiety and left them with few spaces to express their feelings or seek support. The YouthWISE project serves as a beacon of hope, offering a comprehensive support system that addresses the unique needs of young people living with HIV by providing access to information, peer support, and community advocacy. The project has facilitated an essential shift in how these young people perceive themselves and their place in the world through workshops, mentorship programs, and avenues for advocacy. Young people living with HIV have found a platform to connect, learn, and grow. They are not just recipients of resources, but active participants in shaping their narratives. The project focuses on education about sexual health, treatment adherence, and mental health, empowering them to make informed choices about their lives and bodies. So this essentially summarizes what we do as YouthWISE, or what our business has been for the past couple of years of implementation. And yeah, so the aim of the impact study that was conducted was to assess the effectiveness of the approaches used under the project. So some of the key objectives include to examine to what extent YouthWISE was able to influence the degree of uptake and adherence to the recommended self-care practices, for example, condom use, HIV self-testing, family planning, and all those among adolescents and young people living with HIV. The other objective was to understand the influence of the approaches on key health outcomes of young people, such as medication adherence, viral load suppression, health-seeking behavior, and quality of service provided. The other objective was to analyze the effect on the contextual factors that have potentially influenced the practice of self-care. For example, social cultural norms, stigma and discrimination, political and legislative constraints, as well as availability of supportive resources. All this to say that the overall goal of our project was to ensure that adolescents and young people living with HIV aged 10 to 24 in all our diversity are able to practice self-care and fulfill our SRHR and HIV needs in a supportive and respectful environment. So let's see how far we went with this goal. The process of the YouthWISE impact study, this is how it looked like. It was highly supported by AIDS funds who funded this project, and we are really grateful for the support and the belief in young people and our ability. So the first stage was identification of who the research team would be, as well as developing of the TOR for the impact study, before moving on to the next step, which was really assessing the reserve of knowledge. And that meant looking into the documents and all other documentation that we had in this project, as well as sessions with adolescents and young people living with HIV, peer mentors and support groups through consultations. And this was done in 2 steps, initial consultations with the project team, an inception report, as well as an outline of the approaches before moving to desk review, survey, and stakeholder consultation. So the stakeholders, as I've mentioned, was mainly the young people living with HIV in our diversity. It then progressed to the next stage, which is feedback to stakeholders, and this is we are currently in this step, as well as the drafting or the finalization of the impact study report and publishing an article in one of the journals. So that is how the process has looked like. We included another quote as well to try and bring out what we intended to do, or what our aim and impact as YouthWISE was. As a service provider and clinician, I have developed counseling skills through interaction with youth. This interaction has helped me develop counseling skills and consider courses to improve my practice. The suppression rate of viral load suppression rate has increased, impacting clinical outcomes and mental health. Burnout from work can be alleviated, and seeing progress in personal and professional aspects is a relief. This helps me feel accomplished and professionally accomplished. This is one of the participants of a support group in Mombasa, Kenya, who was a health provider. So this shows impact of the YouthWISE project beyond the young people in the diversity, which was the people we aim to serve, but our impact went beyond and influenced healthcare providers as well. A look into our findings from the YouthWISE, or what the YouthWISE impact journey looked like. I am sure most of us are aware and familiar with monitoring and evaluation. So the process looked like inputs, activities for the first from us, and outputs, outcomes, and impacts, which is what we are collecting from what our inputs and activities achieved. Some of our inputs, I'll not go through everything. I will be sure to share the report once it is finalized so that everyone has access. One of our inputs was funding from AIDS funds, baseline data, M&E framework, project plan, staff, infrastructure, equipment, materials, project tools, and resources, which were highly critical in making this project a success. Some key activities, this is not everything we did, but some of the key activities we did include peer mentor identification and training, setting up of support groups, outreach and education, service delivery, access, capacity building, organizational development, as well as advocacy plan and advocacy implementation. Some of our outputs, direct outputs from our activities, were trained peer mentors, sustained support groups, educated adolescents and young people, parents, community members, and service providers, capacitated staff, strengthened organizations, as well as advocacy messaging, shared nationally and globally as well. Some of our key outcomes from our outputs were adolescents and young people living with HIV improved self-care practices, increased number of adolescents and young people accessing healthcare services, more adolescents and young people adhering to ART therapy, large percentage of adolescents and young people being undetectable, and more adolescents and young people advocating for better services and treatment. The report has the numbers and the data of how this actually looks like. So I'm excited to get to share that with all of you once it's completed. The impact that was collected is that adolescents and young people living with HIV are more accepting of their status, are more confident, and have better overall health and well-being. They have more urgency and hope, have more thriving relationships and career prospects, and they're also better able to advocate for themselves and for others at all levels, as well as their ability to step into leadership. Next slide. These are some of the types of impact that was collected from our work. I will just mention what the types of impact looked like without going to examples. So understanding and awareness, attitudinal impact, That is for both adolescents and young people, community members, and healthcare providers as well. Health and well-being, which was a real goal for us. Decision-making and behavior for the adolescents and young people. Social impact, environmental impact, capacity impact, economic impact, as well as policy impact, where community members and leaders, healthcare workers, and district level and national level leadership was influenced by the project. Another quote, by focusing on holistic well-being and the importance of mental health, participants learn strategies to manage stress, cultivate positivity, and even celebrate milestones in their health journey, leading to increased overall happiness. Again, participants of a focused group discussion in Kenya. This was a visual representation of what the picture was before YouthWISE, and this is a representation of a young person living with HIV, and the situation was fear, self-stigma, shock, isolation, no understanding, no information, heartbroken, judgment, self-hate, and confusion. And we are now able to see the transformation in the next slide of the impact, what the impact resulted to the young person living with HIV, and what the input was includes support groups, which enabled the young person to connect with those going through the same experience. She accessed information on HIV and self-care, which enabled her to take care of herself and improve her health and well-being. She was able to access information about services and services that were available to her, as well as the ability to advocate for proper services. She got an opportunity to grow, having been a leader of a peer support group, transitioning to a peer mentor, and also transitioning to other opportunities that exist within the project. She was at the center of programming with the project prioritizing youth programming and youth experiences, as well as knowledge and strengthening of youth leadership as well. She benefited from community support, from family and community engagement, which created an enabling environment for her. She benefited from economic support, where in countries like Malawi, young people in the peer support groups have been capacity built to be able to have their own economic opportunities where they get to earn money as being part of the peer support groups, which is also a sustainability initiative that works. She has role models where staff and peer mentors under the YouthWISE project are young people like her who are also living with HIV and go through the same situation or experiences as her. She has access to advocacy opportunities and advocacy tools, and also policies have been able to change or to adapt to fit so she's able to benefit from improved policymakers that prioritizes her health and well-being as a young person living with HIV. Next slide. Again, some quotes. I had mixed feelings at first about my status. I felt left out due to being positive, like the world was crumbling on me. My self-esteem went down and was completely tarnished. I felt bad and was constantly judged by people. The biggest highlight for me was being able to meet people like me. I felt at home and safe. I got to ask some burning questions which helped to mold me into a champ. My self-esteem and self-worth has extremely improved. Next slide. What the way forward looks like. I have presented this before. We are currently in the final stages, which is finalization of the report and then dissemination. So we can skip this. And yes, thank you so much. Over to you, Mercy.
Thank you so much, Ivy, for that comprehensive youth impact study report. It is wonderful. And some of the key things that I as a person has taken into consideration is just how like young people were impacted, positively, just to make informed decisions in regards to their SRHR and HIV needs, and that is wonderful. And also on roles of leadership. And I love the fact that the report brings out the lived experiences of the young people, especially those that are living with HIV. Now they can be able even to make informed decisions in regards to their HIV needs, and not only that, also on their bodily autonomy and integrity. Thank you so much, Ivy. You deserve a clap for that wonderful report. And so I would love to ask our fellow participants, if you have a question in regards to the report Ivy just presented, you can be able to just type it on the chat box, and Ivy is going to respond to the questions. So we move over to our wonderful panelists. I'm going to give each one of them a minute to introduce themselves comprehensively. They are wonderful. This is a stellar panel, and they do wonderful work in the advocacy field, especially among adolescents and young people, and also on matters of SRHR, mental health, and how they integrate with HIV. So our first panelist who's going to introduce themselves is Yves Zuniga Yves Zuniga from United for Global Mental Health. Kindly introduce yourself, and it's glad to have you here.
Lovely to be here as well. Hi, everyone. My name is Ives Zuniga. I'm based in Manila, Philippines. I'm currently the Policy Advocacy Advisor of United, working towards the integration of mental health into the broader health system, which also includes HIV and TB programming, and also advocating for increased and improved global mental health workforce. Happy to be here.
Okay. Thank you so much, Yves. That was such a wonderful introduction of yourself and the work that you do. So our next panelist who's going to introduce themselves is Borotulu Ayebatari. I hope I pronounced correctly. My apologies.
Thank you. So my name is Aibatari Brutulu. I'm the mental health advisor at PEPFAR at the Bureau of Global Health Security and Diplomacy, which is in the U.S. Department of State. So happy to be here in the webinar.
Yeah, thank you so much. Thank you so much, Brutulu. Our next panelist to introduce themselves is Chikondi Deborah Kateta. Kindly introduce yourself.
Hi, everyone. Thank you. My name is Chikondi Deborah Kateta. I work with Coalition of Women Living with HIV. In short, we say it's COLA. I'm based in Malawi. I work as an M&D officer, but I work a lot with young people working on issues of SRHR, access to HIV services, but also advocating for the mental well-being of young people, especially young people living with HIV. Thank you.
Thank you so much, Chikondi. And our last panelist is Alice Mituga. Kindly introduce yourself. Welcome. Alice.
Hello, everyone. My name is. I'm working with children linked for children. We're implementing a youth care project in one of the regions in Tanzania. Thank you.
Thank you so much, my fellow panelists. So I'm going to ask you, after just a brief introduction on the objectives of the webinar, I'm going to ask all my panelists just to put their cameras on for the rest of the participants to be able to see them throughout the webinar and interact with them. So the webinar aims to advance the conversation on how to effectively implement and sustain integrated services on matters of maybe mental health and SRHR and also HIV, particularly for young people living with HIV, with the specific objectives are as follows. We hope that our panelists here are going to be sharing the latest updates and practices of mental health and HIV integration, how they've been doing that in their various capacities, in the various organizations they work in, and also in the various countries and organizations they represent. And also we expect the panelists are going to help us understand the integration strategies for mental health. How are they including various stakeholders in doing this? And then we will love you panelists to tell us, how are you including young people, especially young people, the youth? How are you integrating them in these strategies of integration of mental health and HIV? And our last objective is, are you panelists who are here, are you joining hands with other stakeholders just to strengthen youth-led advocacy for sustainable integration of mental health into HIV programming? And that now leads us to our questions. And I'm gonna begin with Yves from Manila. My question to you is, given your global perspective, what specific strategies is United for Global Mental Health implementing to ensure mental health integration is in HIV programs, and it remains a priority for global health donors and stakeholders, particularly in ensuring these initiatives are youth-focused and sustainable in the long term? Over to you, Yves. Welcome.
Thank you very much. I wonder if you can see my screen. Lovely. So again, my name is Ives from United for Global Mental Health. Before I answer your question, also taking this opportunity to briefly introduce our organization. So it's established back in 2018 in UK with a vision of a world where everyone everywhere has someone to turn to in support of their mental health. So we work across different organizations in different levels, from national to global, making sure that we can affect systemic changes into how mental health can be delivered and funded or invested. So our main stakeholders are really civil societies, including young people, and also we act as a secretariat to the largest mental health advocacy network, which is the Global Mental Health Action Network in my screen, with over 5,000 members spanning across over 160 countries. So this is our small team across the world. I am here in the Asia Pacific with a large group of our partners coming from the African and European region. So this is our tier strategy. It's quite a busy slide, but just zooming in on the health systems aspect, we want to make sure that the health system is also inclusive of the mental health support, especially for young people, especially within the communities of persons with lived experience of HIV, TB, and or other comorbidities. So we want to make sure there's equal prioritization given to mental health as same as physical health. So a lot of our work really involves with advocating across different platforms, especially at the global level. So part of that partnership has led to, for example, coming up with a joint product with the interagency working group, where we wanted to make sure that our national partners are well equipped in terms of advocating for mental health integration at the country level. So during the national dialogues of the Global Fund, that's the HIV, TB, and mental health toolkit that you can see here. We also advocated for making sure that there's mental health language included in the political declaration in the high-level meeting on TB held last year during UNGA. And so you can see also the group photo. We also conduct advocates around the world every now and then. So this happened in Cape Town last year. The next one will be somewhere in Asia in 2026. But less of me, let's hear briefly about how youth can be an effective mental health advocate from one of our partners named Judah.
My name is Judah Njoroge. I'm from Nairobi, Kenya. I represent Integrative Wellbeing and Basic Needs, Basic Rights Kenya. I'm here at the UNGA in New York to discuss youth mental health and why it matters to global mental health. This stems from my own lived experience and the services that I have developed to the youth in my country and in Africa to promote youth mental well-being. And I hope to be able to share that with the world leaders and tell them that it is important to have our voice and our participation at the UNGA, where we make global decisions about mental health systems. Youth voices are very important to be heard because mental health invariably affects the youth. So if you bring the youth onto the decisions and making the decisions, then they are able to change the system from within because it directly affects them, and they can directly take part in developing solutions that work for them.
Lovely. So that was Judah from Kenya. So moving on, basically just giving a glimpse of the mental health state globally. So over 900 million are affected by mental or substance use disorder. And over 700,000 actually also die um, from suicide each year, more more so affecting those coming from low to middle income countries. And mental health condition is actually the second leading contributor to the global disability. Close to 20% of this are actually coming from children and adolescents, and that suicide remains to be the third leading cause of death among youth. So as you can see here in the graph, actually the mountain or the peak of the mountain is really concentrated around the age of young people. And so one of our vision is to make sure that, by making sure we focus on prevention, making sure there's access to mental health service delivery, hopefully we can address and change this landscape. So some of the priority areas in our approach is really on youth mental health. As I mentioned earlier, aside from the global state of mental health, youth specific wise, it affects 16%. It accounts for the 16% of poor impact of health among 10 to 19 years old, and even affects 20% of world's population of young people. And the onset could be as early as 14 years old. And so we need young people to actually be speaking up for their own mental health experience, especially online on our ground. And that the reason for prioritizing is that it is taking the shortest end of the stick when it comes to mental health investment around the world. One of the approaches that we are working with is through the Being Initiative. So it's funded by the Foundation Botnar and was launched across different countries, 12 of them specifically. Some of them include Ghana, Indonesia, Romania, Vietnam, among others. So it's a platform to make sure that there's youth mental health efforts around prevention, promotion, and research, a platform where young people can exchange different approaches, like, evidence and learnings on youth mental health, and even influence where there's power to make sure that youth mental health is taken into action through partnerships and collaboration. So some of our approaches really around making sure that wherever we go, whether that's UN General Assembly, World Health Assembly, or even other global movements, we want to make sure there's prioritization, increased visibility, and continued advocacy for increased investment on young people, particularly mental health. We want to make sure there's always carved out spaces for young people. We want to make sure we can uh, foster collaborative and collective action for increased participation of youth. So this also focuses mainly on the HIV and mental health work that we're currently doing. One is really about advocating for mental health to be part of the national grant. This is the more sustainable approach. That's why we work, for example, across a range of countries, like 15 of them, coming from mainly Asia Pacific region and the African region, to capacitate national civil societies, engage their policymakers, decision makers, such as the national CCM, or the country coordinating mechanism, to prioritize also mental health. The second main objective is really dedicated for the youth to mobilizing political support and attention for mental health and HIV for young people across a range of stakeholders from both the mental health and HIV communities. As you can see here in the photo, Ivy, being one of the members of the Y Plus, is actually one of our panelists during the recently held AIDS 2024 in Munich, Germany. So it was very intentional for us actually to make sure that part of our panelists are coming from the most affected sector, which is the young people. Last of these objective in this advocacy work that we're doing is making sure there's new financial resources dedicated for HIV and mental health by engaging both the traditional and non-traditional donors. So part of the work product in this advocacy space is to be able to have global fund, for example, come up with an e-learning module on HIV, TB, and mental health. I will not finish this, but just to give you a glimpse of how it looks like.
The delivery of integrated people-centered health services is essential for effective HIV and TB programs, and the promotion and provision of mental health services plays a vital role in this delivery. However, people living with HIV and TB experience higher rates of depression and other common mental health conditions. This has been linked to reduced adherence to treatment, leading to higher rates of HIV and TB deaths. Estimates from United for Global Mental Health Bending the Curve report suggest that integrating mental health into HIV prevention initiatives could hasten the decline in new HIV infections by at least 10% and as much as 16.5%. What this means is that by 2030, over 924,000 people around the world could avoid contracting HIV.
So that's actually an overview of that e-learning module that you can access through the Global Fund. And it actually shows, we can prevent as much as 1 million cases if we start actually integrating mental health into the HIV care. And by that year, 2030, we can achieve as much. The last point, just before I hand it back over to our speaker, is also focusing on a very marginalized population within young people. Young people already have the prioritization of mental health across different governments. And how much more when you actually belong to LGBTQI plus community. And so this particular group face a higher risk of suicidal behavior and more likely to develop depression and anxiety, actually 1.5 times more than the rest of the population. This is really out of being confronted with a complex range of issues, including stigma, discrimination, prejudice. And so young people coming from LGBTQI plus community need mental health support now more than ever. And so these are just some of the approach that we've been doing. One, let the world know that we want to focus on LGBTQI plus and mental health. We collaborated with Elton John AIDS Foundation to come up with a joint blog to raise the profile of mental health across these communities in the lead up to AIDS 2024. Two, we want to make sure there's dedicated safe spaces. We supported the launching of the LGBTQI plus working group in the Global Mental Health Action Network during Pride Month. And third, going directly where power lies, giving that power to young people. We hosted the first ever mental health networking zone at AIDS 2024, which is actually the largest convening of the HIV community. And we even saw 500% increase in membership from the LGBTQI plus working group in mental health. So these are just some of the ideas and approaches that we've been doing. And basically the main learning here really is the meaningful and carving out spaces where needed for participation and ownership of young people. And so we will continue to provide platforms for the voices of persons that live experience of mental health and or HIV and or TB, especially young people. And we hope Y Plus Global will really be on board on this, and we're very grateful for this opportunity to be sharing more about our approaches and current initiatives. So please feel free to connect with me over this email, and also feel free to join the Global Mental Health Action Network. Thank you, and over.
Thank you so much, guys, for that presentation. It was wonderful. And the fact that you just said that there are statistics show that there are 970 million people living with mental health problems and also disorders. That's quite alarming. But I love the fact that you said at some point, our world in United Mental Health, United for Global Mental Health, you advocate for a world where everyone everywhere has someone to just help them on matters of their mental health. And you've also even told the young people that they should go and the donors, they should go where the power lies. They should fund young people just to be able to integrate mental health programs with HIV and TB, because they are the ones who are most vulnerable and at risk. And I love the fact that you brought out inclusion. You've not left any young person behind, regardless of their diversity. You've included the LGBTQI community, and that is so wonderful. That was such a wonderful presentation. So over to our next panelist, our PEPFAR representative, Borotulu. When we hear PEPFAR, when we hear PEPFAR, we just know this is where the money lies. And as young people, we are going to get money to do a lot of advocacy on integration of mental health and HIV and also TB. So my question to you is, as a key player in global HIV/AIDS response, how is PEPFAR adapting its strategies to incorporate mental health services within its existing HIV programs? So specifically, what commitments or policies are being put in place to ensure that these integrated services are accessible to young people, and how will PEPFAR support their long-term sustainability? Over to you, our wonderful Borotulu.
Thank you so much. And I think you all are going to project my slides as well. But as has been pulled up, I just want to say, first of all, thank you for the opportunity to speak at this event. I always love the opportunity to speak about mental health. And as you mentioned earlier, this conversation about mental health and integration, we had it in Munich at IAS 2024. I was happy to be on the panel with Ivy, with Eves, with a few others, and it was such a dynamic conversation. And I'm glad to hear about it afterwards. I think that sometimes when we have conferences, there's a lot of excitement, there's a lot of energy around it. We say, okay, we're going to partner, we're going to do this. And maybe 2 months later, when you're back to doing your work, it's those conversations kind of go down. So it's good that we have this commitment to action, like the title of this session says. So do you have the slides? Not yet.
They're coming up.
Okay, they're coming up. Okay, so as we pull this up, I just wanted to start off and emphasize essentially like what Ives was saying, the importance of mental health and HIV, and just note that mental health disorders and psychiatric illnesses can increase the risk of HIV exposure. These disorders complicate the disease course and treatment of HIV. Mental health issues are also linked to decreased HIV testing, to reduce likelihood of starting and continuing antiretroviral therapy, as well as poor adherence, as well as lower chances of achieving virologic suppression. So you can see there's so many different aspects that are impacted because of mental health. And when it comes to PEPFAR, we really focus in on HIV and being able to reach those 395s. I also want to emphasize that psychosocial factors such as violence, trauma, stigma, and also social and other social determinants can further impact HIV treatment outcomes. So can you shift to the next slide, please? So as they're pulling it up, I just wanted to talk about how mental health ties into HIV programming. So on this slide, I have 2 different sections, one about psychosocial support, which we have been doing in PEPFAR for a lot of years, for many years, as well as this objective that we have as it relates to mental health. So the mental health objective is newer. It's not new, but it's newer. And I'm going to talk about that a little bit after I talk about the psychosocial support. So PEPFAR stands for the President's Emergency Plan for AIDS Relief, and it provides operational guidance and support to countries through U.S. government agencies. So this support encourages the integration of mental health, psychosocial support, and substance abuse programming at all levels of the HIV response. So PEPFAR integrates psychosocial support through its prevention, its care, and its treatment. So these approaches are tailored to the needs of participants across different life stages, including children, caregivers, adolescents, and adults. So that kind of encompasses our stance when it comes to psychosocial support as well. So when it talks about mental health, what we are talking about now is, like we mentioned on this webinar, incorporating mental health into existing HIV programming. And for PEPFAR, we look at PEPFAR supported countries. So our goal is being able to reach those 395s, and we realize that mental health services are needed to promote resilience, to be able to enhance mental health outcomes, as well as those HIV outcomes that I mentioned before, such as adherence, such as viral suppression. Now, I always always give this disclaimer at the end because it's so important. When it comes to PEPFAR, we are doing this in partnership with partner governments. So we are not doing this separate from partner governments. We're doing this in collaboration because we realize that for PEPFAR, we touch on the correlation between HIV, but the countries that we serve in have populations outside of those who are living with HIV that also should benefit from mental health. So we really need to work with the governments hand in hand to make sure that we are moving in the right direction, and what we are suggesting is also what they agree with. So next slide, please. Okay, so on this slide, it just provides a few examples of PEPFAR-funded psychosocial programming for youth. Some of them are focused on mental health. Some of them are focused on psychosocial support. It's not limited to just this slide. If I put on all of the programmings we have, it will just cover this entire slide. So I just wanted to give you some examples of the great work that's happening that's focused in on youth that PEPFAR has supported over the year. So I wanted to also say that PEPFAR's approach is underpinned by evidence-informed psychosocial practices, prioritizing person-centered, family-focused care to improve outcomes for youth. So in PEPFAR, we have a program called the Orphans and Vulnerable Children, which is our OVC program, as well as our DREAMS programming that offers psychosocial support, interventions to children, to families, and especially to youth. So you can see on the bottom right, I have an arrow to DREAMS because this is the program that's directly funded by PEPFAR. And for those who may not be familiar with the DREAMS program, it's focused on reducing HIV/AIDS in adolescent girls and young women. So it stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. And so it exists in several of our countries. And if you are not familiar, I do recommend looking it up and seeing the benefits of the DREAMS program. So for the DREAMS program, they have started to integrate mental health and psychosocial activities in the programming and looking primarily in referral base. So I wanted to also highlight some of the other mentions that's on this slide. The Zandiri program exists in several of our countries. And as you can see with the wheel, hopefully you can be able to see there's so many different program areas that are covered. One of them including mental health. It talks about HIV treatment, HIV programming, etc. So each country has a different focus. And so they also have a website that you can go to and reference and look at some of the materials that they have done. When it comes to the CETA model that's referenced here, this really touches on the mental health programming in HIV, mental health activities in HIV programming. They also have a website as well as Friendship Bench and Grassroots Soccer. So if your programming is PEPFAR funding, it's not on the slide, it does not mean that we're not doing it. This is just to highlight some of the great work that we are doing. So can you shift to the next slide, please? So as they pull the next slide, this next slide is talking about our PEPFAR Burma program, and it's talking about integrating mental health interventions into HIV services through community empowerment. So colleagues from our Burma program they're part of IAS 2024, and we had a booth, a mental health booth, and they presented about the work that they're doing with mental health. And I wanted to bring forth them as an example because they are dealing in a very challenging environment, but it shows the impacts of community empowerment, the impacts of using CSO networks, KP networks to be able to enhance the mental health services. So on the left side of the screen, it talks about strengthening capacity of community networks. It shows that to be able to integrate mental health, you have to really look at all of the different factors. You look at the screening tools, you look at the referral networks, you look at the referral directories. All of these need to be in place before you can be able to set up a proper program. You also have to look at the training and the mentorship. So it's not just to say, okay, we're training people, but how are you mentoring them through the process? How are you ensuring that they're continuing to provide quality services? So the Burma program has actually done very well in terms of their mental health program, and I just wanted to be able to highlight them. So on the right side, you can see I highlighted, I circled the youth network because it relates to the purpose of this call and to show that they're really using different type of services such as hotline services, social media platforms, and community-based prevention services to get to youth, but also to promote mental health. So these are just some few programs that PEPFAR is doing. To be honest, if I can talk for the rest of the hour on the work that we are doing with mental health, but I just wanted to be able to highlight these few. So I think the next slide is my last slide. This shows my contact information, but just also knowing that with PEPFAR, we have a lot of youth-focused work that we're doing. We have an initiative that's happening as well. Can you shift to the next slide, please? So they can see the contact information before I close. Us. Okay. Awesome. Hopefully you can see that. But if you have any further questions or comments, please email me. I would be happy to answer your questions or direct you to those who can. Thank you so much.
Wow, that was wonderful. That was really wonderful, Borutulo. Our participants, if you could be able to give Borutulo and Ives a hand clap just in the comment section. That was really wonderful, giving us the perspectives of the global perspectives on mental health and HIV integration. I've really learned a lot. And just before we move to our next panelist, maybe there are some participants who might be having questions and also reflections. Just like I've taken some things from Borutulo on matters on how PEPFAR has a curriculum for capacity strengthening, how you also have TOTs, and I love the fact that inclusion, you're not leaving any young person behind. You're also factoring in the key populations, and also love the fact that you also use avenues such and platforms such as the social medias just to reach out to a lot of youths. And I love the fact that you also trickle down this information even to community-based organizations, just to ensure like every other young person gets access to this information. And so let me just read some of the questions I have. They're just reflections. There's Pamela Marks just said, excellent presentations. And then there was a question for Ivy. Maybe Ivy, I don't know if you'll answer now or you get to answer later. I'm wondering if you can tell us more about the education component of the YouthWISE. And question for Yves, can you please reshare the lessons learned again and your email, or can you share it with me? And their email address is just typed there. Thank you so much for those wonderful. Buritulo, that was wonderful with Yves, just giving us the global perception of integration of mental health and HIV, and and especially among young people. And I believe maybe people don't understand like the kind of work that just goes a lot into mental health, but now we know where to direct our, we know where we can get this information and comprehensive information, even in the global context. Thank you so much. You deserve a round of applause. So I can see we don't have any other, okay, let me just check, or they were the same ones. The questions are over, and also the reflections. Our fellow participants, if you have some reflections on what you best presented or what Buritulo presented, leave them on the chat. So we move over to our youth care and YouthWISE partners now in the African context, and we have Chikondi and Alice. And I think Ivy just gave a brief introduction of YouthWISE and youth care projects while we were starting. And yeah, maybe just as Chikondi and also Alice, as you're going to come through, you might give us just some reflections from youth care and YouthWISE, and how the stakeholder strategies can apply the gained insights into work on mental health in integration to HIV and sustainability efforts. So we start with Chikondi, and the question to you is just give us a reflection of how youth care or YouthWISE on the strategies that you're using just to integrate mental health into HIV programming among young people, and how are you making this a sustainable effort? Yeah, over to you, Chikondi, and then Alice is going to take over. Thank you.
Can you see my screen?
Yes, we can see your screen.
Okay. Thank you so much for the opportunity to be here and also just share a little bit about the reflections on YouthWISE. I'm happy that Ivy introduced the project already, so I don't have a lot of work in terms of introducing the project to our participants this morning. I mean, this afternoon rather, sorry. But then I just wanted to talk a little bit more about the things that we had been doing and the levels at which we're operating in terms of the YouthWISE project, which basically the main thing about it was the promotion of the self-care concept. So this concept was being promoted because we realized that self-care can actually be used as a tool for prevention of HIV, treatment, as well as care, for especially for young people and young people living with HIV. So that was the hallmark of our work in terms of the YouthWISE and the promotion of the self-care concept. So again, Ivy already talked about where it was being implemented, but then the cornerstone of the self-care for us was you first. So the idea that for you to be able to help other young people, whether to stay mentally fit, to be okay physically, you first of all have to look at yourself and take care of yourself. So much as this was being done at different levels, from the individual level to the communities, we wanted to, first of all, look at the young people and empower the young people first so that they are able to help other young people as well. So what were we doing in YouthWISE? We're mostly promoting the adherence, ART adherence. We're also promoting healthy eating. We're promoting exercising and ensuring that you are staying fit as a young person, but also as a young person living with HIV. We're looking at communities, making sure that young people are talking, because part of mental health is ensuring that you are actually communicating. Some of the challenges, whether it's stigma and discrimination, because you're not able to talk to other people, you get to suffer in silence. And so I'm happy that when Borutu was presenting and also Yves was presenting, there were a lot of figures that were being mentioned there in terms of how young people are affected. People are affected across the globe with mental health. So we wanted to make sure that young people are talking in their support groups, which, by the way, was the entry point that we were using to reach out to many young people that are living with HIV. And so in the support groups, there were issues of communication, psychosocial support that they were giving to each other. All that was being done to ensure that the young people are able to stay mentally fit. So also, we were also looking at having safe sex. When you're a young person living with HIV, and even a young person, are you practicing safe sex? Are you able to access commodities that are necessary for you to have safe sex? For example, condoms. Do you have access to condoms? Do you have access to information about how to use condoms? Do you have access to information about SRHR, family planning? Those were issues that we were promoting in the YouthWISE project, especially also when we look at the concept of self-care. So we were looking at this on different levels. First of all, it was at individual level. I already talked about you first. As a young person, and also a young person living with HIV, are you taking care of yourself? Are you prioritizing your own health? Because one of the things I would always talk about in our project is that take care of yourself first. We have a lot of young people that we are working with as volunteers. Some are working as psychosocial counselors. Some are working as community-based distribution agents whose main role is to take services to the communities, to other young people. We have other young people that have been trained to provide cancer screening services, especially on information sharing, because they can't necessarily provide the testing of the cancer, but rather giving information to young people. So the idea was, when you're doing all these things, are you prioritizing yourself first? When you go to tell other young people to say, let's go access condoms, are you accessing condoms? When you go and tell other young people, be mentally okay, are you mentally okay? So that was the idea about focusing on the individual first, because we believed that when the individual is fine, then when they are going out to help other young people, they'll effectively do that. One of the things I would always talk about in the project, and we still talk about it, is that you can't necessarily give others what you yourself don't have. So the idea is, first of all, take care of yourself and then go and help other people. And also, how is the community coming in? Whether it's family, the people around you, whether they're friends, whether it's religion for people that are religious, in the families, in the churches, in the mosques. What is the role that the community is playing in ensuring that a young person is mentally okay? Is that information being given to the young person to make sure that they are actually fine? Is that information that is given to the young person to make sure that they're able to help other young people? So we're looking at the role of the community in ensuring self-care, but also mental health, as we are discussing right now. And services, I already talked about access to services, ISRHR services, family planning services. And so we're looking at all these people that provide services, even psychosocial counseling services. Do we have enough psychosocial counselors? Do we have enough people that can advise young people on how to practice safe sex? Those are healthcare workers. So those were also some of the things that we were focusing on in the YouthWISE project. And also the nation at large. Are the policies enabling young people to access services? Are young people aware of the policies that promote their rights to access services? And also at institutional level, the organizations that were promoting the self-care concept, also YouthWISE project, are we doing the right things by the young people that we are working with? You asked a very important question, how are we engaging the young people that we're working with? And so that was also something that as organizations that were implementing the YouthWISE project had to navigate to ensure that young people are at the forefront of promoting the self-care concept and also being the champions of the YouthWISE project. And then you asked about the strategies that we were utilizing in the YouthWISE project. One of the things that we focused on was advocacy. This has also been mentioned by the previous speakers, the importance of young people advocating for their own mental health. Because sometimes when you speak for other people, people think that you're lying about that. But when it's the communities coming out to say, this is what we want, whether it's a provision of psychosocial counseling in the communities, when they're advocating for that on their own, then people know, duty bearers know that this is a serious issue. So we made sure that our young people are empowered to advocate for their rights, to advocate for the services that they require in their communities, and also just raising awareness. Are other young people aware of self-care? Are other young people aware of the mental health services that are provided, whether in healthy facilities and in communities at large? So that was also a hallmark of our work, to make sure that we're raising awareness to every young person, whether through community engagement, whether social media engagement. That was something that we wanted to do, and we actually did in the YouthWISE project. And also another thing that we did in the YouthWISE project was the capacity building of the young people themselves. To be able, I already talked about advocacy, for them to be able to advocate effectively, they have to have their capacity built. And so we made sure that we build their capacity. And in building their capacity, we've seen that we've created leaders that are able to speak to other duty bearers, to say, this is what we want as young people, and these are the services that we are demanding for. And so we built their capacity, and in building their capacity, we've built leaders, but we've also built young people that are able to provide services to other young people in their communities. Earlier, I talked about the youth community-based distribution agents. That was also a capacity program that we intentionally took on board to ensure that we have those cadres, 9 licensed cadres that are able to bring services closer to the young people. Because another thing that they were struggling with was distances. So we wanted to make sure that we bridge the gap of distance, and so that the services are closer to them, so that young people are able to access those services. And another thing that we utilized is technology, using social media to raise awareness about self-care, to raise awareness about mental health, to raise awareness about our YouthWISE project in general. So we took the social media by storm. I remember last year when we were doing the self-care month, we had a lot of campaigns going on both in Malawi and Kenya, where throughout the month we're putting messages about self-care. So that was also something that we utilized in our YouthWISE project. Thank you so much.
So amazing, Chikoni. That was so amazing. I love the fact that you brought out the very innovative strategies that you're using, and we can all see like these strategies are running close right from when we started from events right to Burutolu and now to you. And that is amazing, because now we can be able even to share best practices on how we are going to make sure mental health and HIV and also SRHR among young people is well integrated. Thank you so much, Chikondi. And now we move over to Alice. Alice, you can give us your reflections and also strategies and stakeholders that you engage on matters of mental health. Yeah, thank you, Alice.
Okay, as the former speaker was saying, I'm not going to dive so deep to the introduction of the project because Ivy has already introduced it, but I'll just put a short summary narration about the Youth Care project. The project actually is implemented in Tanzania in Mara district, and actually it is designed to promote the sexual and reproductive health rights and HIV prevention among young people, especially the adolescents. The project actually focuses on friendly youth services, enhancing their awareness and building capacity for the community health workers, educators, and other stakeholders to provide better sexual reproductive health support. Actually, by working closely and directly with the youth, the project actually has empowered them with knowledge and skills for them to access these services, and also being community advocates for other youth in the community. In working with other stakeholders in access for youth to access these services, we have been engaging them in several ways, and one of them we have managed to get this community engagement. Actually, the active involvement of local stakeholders, including the traditional leaders, parents, and youth groups, has proven to be very effective in breaking down cultural barriers that actually make it hard for young people to access these services. Also, we emphasize stakeholders to use this inclusive approach into their ongoing work to foster strong community support so that they can help youth to access these services. Another issue is the capacity building. This capacity building actually is directed to the youth. We use peer-to-peer intervention and also the educators and the community health workers. As we all know, these supporters actually are designed to support the youth so that they can access these services. So training health workers on youth-friendly services has improved the services delivery, making it more accessible and welcoming for young people. In this way, the project actually has encouraged to continue investing in capacity building initiatives to ensure that there is a long-term success of youth-centric services. Another issue is peer-to-peer interventions or youth-led advocacy. Actually, we use other peers because we think sometimes peers, they need to hear from the other peers on issues that we want to present to them. It can be very hard for peers to listen to parents or educators because of some of the issues in the community, but it is easier for them to get to be capacitated by other peers. So we use peer-to-peer intervention, and we empower these young people to become advocates of other people for sexual reproductive health rights and HIV awareness. Actually, this project, the Youth Care project, has seen an increase of ownership and sustainability among youth, and partners actually can adopt this youth-led advocacy model to create a lasting change and ensure that young people or young voices are heard and represented well. Another issue is the multi-sectoral collaboration. This collaboration actually is between the healthcare providers, health centers, educators, local governance sectors, and leaders, which has enhanced the project's reach and impact. Actually, stakeholders are brought together, and we normally meet these stakeholders quarterly so that we can understand their work in the community. We can understand how they are supporting in these implementations. So we also encourage other people to use this kind of strategy to make sure that we get to help young people. Another issue is the monitoring evaluation. We are very keen in monitoring our progress, and feedback mechanisms have been highlighted as crucial in defining the project. And since the project has started, we have been having a number of visits to the field to see how the project goes and where to refine and where to improve. Also, we have been monitoring the involvement of the stakeholders in the community where the project is implemented. Another issue is policy advocacy and budget allocation. Recently, we have been having discussion with policymakers for them to be for them to help actually in budget allocation. And one of the key lessons for stakeholders here is to, the importance of policy advocacy in ensuring that the project that we are doing is sustainable and youth are given the support that they need. Also, engaging local policymakers and advocating for increased budget allocation for sexual and reproductive health rights and HIV prevention can lead to long-term improvements and service delivery. Also, coming back to the mental health issues, well, we are not so much focusing on mental health issues, but we will not leave them behind. Although we are focusing directly with sexual and reproductive health rights, but we are committed also to addressing mental health needs for young people in all our interventions. We're also prioritizing making referrals to those who are affected by mental health challenges when identified, ensuring that they receive a comprehensive support they need from the peers, the community health workers, and other stakeholders. Thank you.
Wow, that was wonderful, Alice, and applause from me. That was a very wonderful presentation. Very precise to the point, and I love the fact that you brought out how you use peer education and also community health. In Kenya, we call them community health promoters. I understand in other countries they call them the community health workers, where they can be able to cascade information of integration on matters of mental health and HIV. Even to the young peers at the community level. I want to thank you, the participants, so much for joining this. I can see Mercy Tisi, Tanzania is represented, Manila. It's a global affair. Thank you so much, YPlus, even for making this session, because it's more of a global affair. Technology has brought us to a small global village where we can be able even to share best practices and even be able to integrate the knowledge that we learn from each other. So I want to give all the panelists each 1 minute to give their closing remarks as I open the floor for questions. Perhaps I will read something that is written in the chats. Hi, Charles Chinguo here, YPlus Malawi. Kindly share the presentations. Charles will be able to share the presentations with you. And then there's Pia Edward. He says, what are the strategies? Any panelist can answer this. What are the strategies ahead of integration to ensure we serve and respond to the needs of the affected youth with mental health and have a proper channel of communication to ensure those in need of services are linked and are served with the appropriate support and sustainable mechanism is identified? And then we have another question here. No, this is a reflection actually. I think the best approach is to set up friendly and confidential spaces or platforms within facilities and communities and enable young people to voice out their struggles and be able to share possible solutions. This is Tabisa from PATA. And I believe Yves talked something about safe spaces when he was making a presentation. Also, I think all the panelists spoke about something on safe spaces. So I want to throw this round of questions to the panelists. Perhaps you can just answer as you're giving your closing remarks. Thank you.
Perhaps I could start. And then we can just pass on the mic. Great. Thank you very much again for this opportunity and for this platform. I hope Y Plus Global will continue to work with, to work for, and to work together with young people. Continue being an activist across different platforms, across different levels of influence. And integration is still a far-fetched journey, but it's good that we're now seeing the movement from a lot of different stakeholders across different directions in terms of moving the thread from the what to more on the how. And hopefully young people can take part proactively in that journey towards finally achieving mental health inclusive HIV services and care. Thank you.
Thank you so much, Yves. Before we move to Bruto or Chikondi or Alice, somebody just said, thank you very much for the presentation and a big applause to all the panelists. So panelists, a the participants have applauded you. I learned a lot during the session. That is so wonderful. And this is Minerva Koum joining from Cameroon. You can see how technology has made this a global village. And then thank you so much for the presentation and a big applause. That is from Cameroon. And then there's Tekuvai. Thank you so much for the wonderful presentation on integration of mental health services to young people living with HIV, joined from Zimbabwe. You guys, people are listening from all over the world. So this is such a wonderful job. So I move over to Alice. You can maybe just give us a closing remark. Yeah. And maybe just answer one of the questions that was asked. How do you think safe spaces should be put on health facilities on matters just to be able to cascade information of mental health and HIV integration? Yeah. Then we'll move over to Chikondi and then we end with Buritulo. Thank you.
Okay, thank you. So concerning the youth safe spaces, actually they're very important. We were having also conversation on the same issue in our programs. We are looking forward actually in making sure that youth are getting their spaces, especially to the health centers, so that we can help them actually to air out and to get the support that they need. By summing up, actually, we are open to continuous learnings and we are committed actually to integrating mental health intervention in our upcoming projects. And by staying informed and responsive to emerging insights from other members, we aim actually to enhance our approach and ensure that all our initiatives address both sexual reproductive health rights, mental health, and the need of youth effectively. Thank you.
Thank you so much, Alice. Over to you, Chikondi.
Thanks. I just wanted to answer a quick question about the strategies. If someone is already not okay, how do we help them? I think you'd be amazed at how young people help in terms of openness and talking to each other. That's one of the things that we're promoting, to say, if you are suspecting that someone is not, you look at them, because sometimes we miss at the small things, the signs that we're there, we're thinking, oh, it's just normal, but they're not normal things. But through the project of YouthWISE, we actually learned that previously I talked about communicating with each other. It's actually the first step. Are you talking to each other as young people about somebody that you know is not okay? And if you're talking to each other about it, how are you helping them? The first step is to be able to open up to other young people that can help you. Don't keep those things to yourself. It's actually destructive when you do that. So the first step is watch out for the people that you know are not fine and help them by first of all talking to them and then referring them to the right people that can help them, whether they're psychosocial counselors in the healthy facilities or in other communities that have psychosocial counselors. So the beginning of all that is conversation and then referring people to the right individuals. And of course, safe spaces are working. Currently, we've adopted the support groups that we are using in both Malawi and Kenya, and they are working effectively. But other than this, the support groups, which are basically at the community level, we also have youth-friendly health corners in different healthy facilities. That also helps because that's the place where young people can actually, first of all, access services, but also be able to talk to each other and talk to the right health workers that can give them the right information and also give them the right services that they require. So obviously, and of course, safe spaces are necessary, and we must advocate for safe spaces. They are working. We know that because in the YouthWISE project, we've seen how effectively they are helping the young people to even adhere to ARVs. So they are working. We must advocate for them. Thank you so much.
Thank you so much, Chikondi, for that. And before I move to Buritulo, I just want to read another comment. Hey all, I'm Abigail Boateng, a person living with HIV from Ghana. That was a wonderful presentation. This is wonderful. And then now we have somebody from Burundi, Claudine. Thank you for the presentation. Claudine from Burundi. That is so wonderful. And then there's Abigail. Thanks so much. I have learned so much. Those are wonderful comments from the participants. You can see we have very many participants from different countries. We also have Franz Muronga from Namibia. Very exciting and informative presentations. Kindly share. They will be shared to your email. Thank you. Borutolo, over to you. 1 minute. 1 minute.
Thank you so much. I just wanted to say once again, like I mentioned, thank you for the opportunity to talk about this important topic. And I wanted to echo, some of my colleagues that talked about the importance of youth-focused, peer-supported work that we do. I know when I was in South Sudan a few months ago, I was talking to some of the youth workers there that had started their version of the Zandiri project. And I was quizzing them. I said, if somebody comes in and they're hesitant, what would you tell them? And I asked, why is youth-friendly services important, or why is it important to have a peer person here? And they said, you want to be able to see yourself. You want to be able to talk to somebody that understands where you may be from, and someone that looks like you. I think that the colleagues talked about you cannot give what you do not have. And I think that was so important because, you're giving because it was given to you. And that's how we continue this process. So, the physicians are there, the counselors are there, but that peer-focused work is so essential to the work that we are doing. And in the chat, somebody talked about before mental health integration, what do we do? And I would say the psychosocial support that we are talking about on this call is really essential. I think that's probably one of the first steps to really establish that psychosocial support before you even talk about mental health integration, to make sure that young people are included and they're not left out in the care that we do. So once again, I think that's my 1 minute. So thank you so much for the opportunity to reflect. And I was just taking notes on what people are saying. I'm very glad to be part of this conversation. Thank you.
Thank you. Thank you so much, Burutulu, for that. Now I want to invite Ivy. Before I invite Ivy, she answers the question, maybe as she gives us some closing remarks as we finish on this. I have learned that from all the panelists, some reflections, it's like the strategies that we have are cutting across all the globally, not even all the countries globally. All of us are doing advocacy. We can continue doing advocacy on integration of mental health in HIV. And also we are creating awareness on integration of HIV and also mental health in a different capacities. Some are capacity building young people, some are using technology just to do maybe X spaces, a Zoom like we're doing here just to empower young people. And also some of us are just trickling down information through community health promoters or community health workers, just to make sure the youth at the grassroots level is able to get this information. There's also a powerful aspect of even creating awareness of storytelling. I think when Ivy was presenting, some of the lived experiences came out as a result of just storytelling. Storytelling is a very wonderful tool just for capacity building other young people, knowing that they are not on their own on this journey. There are very many, and there are ways and even places that you can get help in case we have mental health issues. And we've also learned we don't work in silos. You can see we are working together. Just like Burutulu, you said, when you met at the conference, you didn't know that this could happen quickly. Like we'll have such a wonderful session like this. And now you can see the power of just working together, synergizing our efforts and not working in silos, just to make sure that integration of HIV and mental health is not going only to happen in our countries, but it's going to happen globally. And last but not least, engagement of different stakeholders, starting even from the political leaders. Let's ensure that we have goodwill from them so that even they can be able to lobby for resources for us, especially now that the Global Cycle 7, maybe for those who are implementing Global Cycle 7, the YouthWISE partners, the Youth Care, just allocation of more funds for integration of mental health and HIV advocacy, and also traditional leaders. It's very important. I think it's Alice or Chikondi who spoke about it. In Tanzania, they also engage in traditional leaders because there are some people who really believe on traditional leaders, just to be able to cascade this information even to the communities that believe in them. And yeah, I want to pass it to Ivy to answer her question, just as she gives her closing remarks, and then we're going to wrap it up. Welcome, Ivy.
Thank you, Mercy, and you've summed up everything pretty well. I feel like I'm going to water down what you've said. But someone asked about how, I'm wondering if you can tell us about the education component of the YouthWISE. So how education looks like in YouthWISE is pretty different. It has taken the form of capacity building and technical assistance, where for us at the global level, it is about ensuring that country partners that we work with, both under YouthWISE, YouthCare, and all our other projects at Y Plus Global, have enough capacity to conduct advocacy. They have resources, they have access to platforms, they have strengthened organizational structures and systems to make sure that this is possible for them. It also looks like ensuring that young people have access to resources on self-care and training young advocates on this. We make sure that we adapt at AIDS 2024, I mentioned that we make sure that we adapt resources that are produced by WHO and other organizations, and making sure that they appeal to young people, that is through videos, infographics, and other things that are young people relevant. We also utilize events and conferences, for example, the upcoming international workshop on HIV and adolescence, to make sure that we train young people on self-care and really normalize self-care as a concept. We are also into leadership and youth leadership, and making sure that young people grow from different levels, from beneficiaries to peer mentors to even project implementers, also plugging into different projects at Y Plus Global. And as Chikondi has mentioned, at community level, it looks like training peer mentors, training community-based distribution agents, informal education, peer-to-peer learning, as Alice has mentioned. So all this is what takes the form of education for the project and most of our projects as well. And just to sum up the entire conversation, we are just on time. I would just really like to thank all our panelists. Thank you, Yves. Thank you, Borotulu, Chikondi, and Alice. You have done amazing, and I'm glad that the audience has really been receptive to what we had to present today. Sometimes it is really hard to break down concepts to people, so I'm really glad that you are able to do that. And I am hoping for continued collaboration in all the work that we do, all the opportunities that you have. We have a large audience of young people that look up to us, and young people in our diversity. So please make sure to reach out to us, and we'll be sure to make sure that young people plug into the opportunities you have. To Mercy, you've done great as a moderator, and Mercy is one of the implementing partners in YouthWISE. Also, this is what we do. We make sure that young people have access to platforms where they can really showcase how good they are. And as you've seen, she's really good at what she does. So yeah, thank you everyone for joining. We'll be able to share the presentations and everything after this. And yes, that should be the end of our webinar today.
Ivy, I was requesting everybody to open their cameras and just wave a bye-bye.
Yeah, and we can take a photo.
Yeah, we feel like it's a global village right here. Participants, kindly open your. We also want to see you. Have they opened, Ivy?
Tawanda, please help in.
Let's see if we are able to let participants turn on their cameras. One moment.
Okay.
Unfortunately, this would take a lot of time. Can we do a screenshot of the panelists, maybe with the attendees tab open on the side? Let's try that.
Yeah. Have we done that time?
Abigail has made sure she has so I think the rest of us can.
Yeah.
Yeah, Abigail.
Okay. So guys, it was really nice connecting with you. Thank you, Ivy and Y Plus Global, for making this a global village. We feel like everybody in the world, we are connecting with everyone in the world physically, but virtually. We hope to have more of these sessions, and I hope to see all of you and engage with you. And thank you, our stellar panels, for the wonderful insights. And we ask each one and every one of the participants, let's follow each other on our socials, X, LinkedIn, Facebook, Instagram, and also TikTok, and make the world realize that integration of mental health and HIV is critical, especially among young people. Thank you and have a nice evening, a nice day. It depends on where you are. Bye-bye.
Thank you. Bye.
Bye.